The chair of the National Transportation Safety Board Wednesday warned there is a culture of silence around mental health and it's affecting safety in aviation. Jennifer Humendy's comments came at the opening of the NTSB's day-long summit exploring the issue. She says current FAA rules cause people to lie about the state of their mental health or not seek help. The Airline Pilots Association, which represents some 77,000 pilots in the U.S. and Canada, has also called for changes. CBS News senior transportation correspondent Kris Van Cleave joins us now from Washington. Kris, what happened at Wednesday's summit?
Well, John, the fact the summit happened at all, I think, is significant in part because there really does seem to be a stigma around talking about pilot mental health. The system is set up that even reporting seeking care can result in pilots getting grounded and have to really go through a challenging and obtuse process to get back to flying, and that, the NTSB chair Jennifer Humendy argues, creates a culture where people either don't report or don't seek treatment in the first place and just try to soldier on, if you will.
And this is an obvious question, but here I am going to ask it anyway. What effect does this have on passengers?
Well, it's important to stress that the nation has the safest aviation system in the world. But, you know, we're talking with a United Airlines captain in between panels today, and he's like, you know, it can be as subtle as you're in the cockpit flying and your mind is on what's going on back at home. And that level of distraction in an emergency, well, that could be the difference between a safe landing and something happening. And then you can, you know, take that even further with people that are really battling depression and other things. One of the panelists asked sort of everyone and no one, would you rather have a pilot who is flying depressed or a pilot who is depressed but on medication and flying?
And was there an answer?
Well, you know, the depressed pilot would be somebody who's not seeking treatment, who's not getting help. You know, we heard from, rather convincingly, from a United Airlines first officer who grounded himself because he felt his anxiety and depression was getting ahead of him. He went and sought therapy, sought counseling. He's on an FAA-approved antidepressant. And it's been a year, and he's still maybe up to a year or more away from going through this process that it doesn't necessarily have the best transparency or efficiency to get his medical certificate reissued so he can fly again. And without that medical certificate, that pilot can't fly, which means he can't make a living. And that is why you see really some reticence on the part of pilots to talk about it. They risk their livelihood.
And so very quickly, Kris, what kind of changes were discussed to get rid of that culture of silence?
Well, you know, the FAA is also starting now to look at these regulations. But, you know, one would be better clarity, better transparency as to what drugs are allowed, what drugs are not allowed, what the process is, and speeding up the timeline to evaluate who's fit to fly again. There are broader aspects of you know, making it not something that you necessarily immediately get your medical certificate pulled if you seek therapy for something. That, you know, the definition of depression that the FAA is using, critics say, dates to 1950, and certainly our understanding of what depression means has changed since then.
Kris Van Cleave in Washington. Thanks so much, Kris.
Sure thing.